We're here with Dr. Heather Zalewski. She is the Medical Director of Psychiatry here at Shodair Children's Hospital. And we're going to just maybe visit a little bit about what's going on with Shodair lately. Heather, can you tell us what's happening at Shodair? We're seeing patients. How are we operating these days?
Yes, so Alana, when the pandemic came to Montana, we made a strategic decision to reduce our census. We closed 2 of our units, 1 acute unit and 1 residential unit. So we still did have 1 acute unit up and running and 1 residential unit up and running. Now that things have eased a little bit, we have reopened our 2nd acute unit. So our acute bed capacity is back to normal. So we have 30 acute beds available every day for children under the age of 18 who are in crisis, and taking calls and referrals for those.
So we have space for more. As of today, we could take more patients.
Absolutely, we have space for more acute patients. Right now, our 1 residential unit is still closed. However, we are looking at creative ways to staff so that we can reopen that unit in the near future as well.
Great.
And then the other really exciting thing is, despite everything being shut down and all of the closures and so forth with the pandemic, we did decide to go ahead and open up our Butte Clinic. So although we are seeing all of our outpatients remotely and intend to do that for the near future, we do have a clinic in Butte now. So that's really exciting too.
Great, that is exciting.
Yeah.
And so I think the number for all outpatient is the same, which is 444-1125, and I'll put that in the comments below.
Yep.
And then what about, what do they do if people think that they need an acute admission? What is the process?
Yeah, so they can call our admission line, which is 444-7521, and if you want to put that in the comments to Alana.
I will.
We do require that all patients that are coming in be screened by a medical provider just because of the pandemic, and most of our referrals do come from either pediatricians' offices, emergency rooms, or outside therapists. So if a family is struggling, I would really encourage them to either contact their outpatient providers or have their child evaluated in the emergency room, and then they can give us a call if they feel like the child needs to be admitted.
Great. From all over the state?
All over the state. We serve all of Montana.
Great. No matter what your insurance or ability to
pay?
pay?
Absolutely. Yes. Most of our children are on Medicaid, and then we do have some private insurance, and then if a family is uninsured, we will work with them. We have a Shodair policy, which is reducing like a sliding fee scale, and we really want any child that needs to be hospitalized to be able to get that help. So.
And what are the diagnoses of patients that are typically at Shodair?
Sure, yeah, well, we have a lot of patients who come in a suicide crisis, and underlying that is often depressive disorder. Many of our children have experienced trauma, so I would say post-traumatic stress disorder, PTSD, is another very common diagnosis. We do see some children who have diagnoses on the bipolar spectrum, and we do see patients who have diagnoses on the autism spectrum. So really, I would say there really isn't any diagnosis that we wouldn't treat here at Shodair. I think there are some cases, so for example, if a child has a really severe eating disorder, we just don't have the medical capability to care for them. And unfortunately, this is a small amount of children, but we just don't have the nursing expertise to treat children who have type 1 diabetes. So other than that, we really try to take anybody who needs that level of care.
Great. Anything else that you want to update us about, Dr. Z?
I think that's all. Just we're here, we're open, we want to help Montana children, whatever kind of level of care they might need. We have really good availability still in our outpatient clinic, so if you call that 444-1125, chances are you will be able to get an appointment for your child, either to be seen for a medication evaluation or for therapy within a few days to a week. So give us a call.
Thanks, Heather.
Yeah.